First of all, thanks for your interest in the DBA program. So my name is Simcha Jung. I'm the director of the DBA in Health program at UCL. I'm a professor of management and healthcare innovation. And so I'm very happy to share with you this really interesting program. So let me see. So who are we? Maybe first, so not all of you might be familiar with the UCL Global Business School for Health. We're really the first business school for health, completely dedicated to educating, training the next generation of health and healthcare management leaders. And so we really think that in order to deal with the enormous challenges that the health systems are facing, we're talking about sort of aging populations across the globe, a rising importance of managing chronic diseases. We've all lived through the COVID pandemic and the enormous challenges health systems face. This pandemic has laid bare. And so we really believe that that there was this necessity to have this business school dedicated to health, because we believe that some of the research and knowledge from the field of business is really can add a lot to dealing with those challenges. And we are very much a very interdisciplinary school as well, connecting sort of the health, the biomedical aspects, and the business and the social systems these healthcare systems need to be managed in. So that's, as we question the status quo in healthcare management, our aim is really to teach our students, to inspire them to work and achieve and help to achieve the public good. So why do a DBA focused on health? So the Doctorate for Business Administration for Health. So what this program really offers students is to, so our vision for this program is to educate the next generation of thought leaders in the healthcare field. And what we would, how we achieve that, how we facilitate and equip you to develop into a thought leader in your particular professional field. It's to train you in research skills and the methods and the scientific knowledge you need to advance thought on these critical challenges our health systems face in a really scientifically rigorous way. And so the idea is to train you as a thought leader in your professional field. And this should allow you, or the idea is that this will allow you to transcend where you're currently at, sort of the role you have within your organization, and to establish yourself as a visible presence in sort of global debates about the within the context of the professional field you're active in. So this thought leadership in a professional setting, it not only requires a strong grounding in scientific, the latest scientific research, scientific methods in your field. It also requires support in your professional development, and so that's also a critical part of the program. And some of the modules that are part of the DBA, they're really not as much focused on the science and the methods, but also about, for example, about communicating research and communicating, establishing yourself as a sort of developing your own brand as a thought leader in your field. So yeah, so this is as I mentioned, the UCL Global Business School of Health for Health. We're based on the new UCL campus, a highly sort of interdisciplinary initiative, very exciting initiative, launched by University College London on the site of the old Olympic Park. And yeah, so this is a program that is a very interdisciplinary sort of the vision behind UCL is really to it's a very interdisciplinary vision, and we have on this new campus all kinds of new initiatives that link into the overall vision of our school. For example, we have a new disability innovation hub located in the same building. So there are lots of opportunities to to connect and interact with researchers across UCL East and the broader UCL community. So so it's a very varied international program with a focus on various aspects in the healthcare field. So hospital, social care focus. We have a strong support you in doing field work. You can do applied or theoretical project. And so a lot of students, they bring their own data from their own professional settings. But we also have researchers, doctorate students who work on their own sort of data that they collect separate from their work, or students who work together with faculty on projects faculty work on and access those the data that is available through those projects. So we are embedded. Global Business School for Health is a part of the Faculty of Population Health Sciences. And so you have really access, I will talk a little bit more about that later in the presentation, to expertise from across the school and the faculty, which is really a very multidisciplinary faculty with expertise, cutting-edge scientific research on really an enormous amount of aspects of what it means to do research on health system and health. So some of the highlights of this program. So this program, it's really designed for professionals who have a full-time job and who do this on the side. So it's designed to provide you the flexibility to study while working full-time, as already in quite senior positions. The program consists of 3 parts. We have a taught component during years 1 and 2, where we introduce you to sort of the many different research fields in the healthcare management area. We train you in scientific methods that you will need to do research in this area. And during year 3, you'll work on a professional practice portfolio. And then during years 3, 4, 5, you'll actually work on the actual research for your doctorate thesis. So it's most of the learning will be asynchronous. So you'll be able, at your own convenience, access material online through our online learning platform. You'll have virtual meetings with me and various faculty involved in the program on a one-to-one basis. And but 1 week every term, you'll be coming to campus. And we have we organize these once a term, 1 week residencies, where the aim is really to sort of immerse you in the research environment of the Global Business School for Health and the broader UCL environment, and sort of sort of becoming part of a research environment that's really very difficult to achieve through online learning. So that's really why we have these residencies, where you will interact with fellow students, discuss your research with faculty on site. We'll have invited speakers on sort of topical themes in the healthcare management field. And you'll, especially during these these first terms, the first residencies, you'll be able to meet lots of faculty have conversations about potential research topics, and just see which of the faculty members you feel that there is a good connection, and who could be a good supervisor for your research. So yeah, what some of the highlights? UCL, of course, we are the #1 research according to the latest research assessment exercise, which measures research quality among UK institutions. We are ranked #1 in the fields of medicine, health, and life sciences. Yeah, so we're a top-ranked universities where really we have cutting-edge science across the different scientific disciplines, in the health sciences, in the life sciences, biomedical sciences, and also in sort of the business and health system perspectives. You need to deal with these health system challenges that we're equipping to help you deal with. So yeah, attending a world top 10 university, ranked 7th in the world for global health. And you might have read that we've been named best university of the year by the Times this year. And of course, when you're here in London for the residencies, you'll have the inimitable experience of being in London, which is really a global city and also a leader in health and business. So what makes this program stand out? I already highlighted some of the aspects. We are the only DBA, Doctorate of Business Administration, focused on the healthcare sector. Healthcare is really integral to everything we do in terms of our research, our education, our knowledge exchange. This program is specifically designed for aspiring healthcare leaders with cutting-edge contemporary topics. This is topics such as sort of digital health, sort of redesigning health systems for precision medicine, managing innovation in healthcare, in life sciences companies, etc., etc. So yeah, our lecturers and research advisors, they're world-leading researchers in their field with a range of interests. And graduating from this program, you'll have access to our, with a discount, to our executive education offering as well. And I think really the networks connections that you will make, so this is a very international program, they will last you a lifetime. So yeah, so what's the type of student this program is aimed at? So we are really looking at students typically with some years of experience, wanting to gain an applied research background to drive forward an evidence-based approach in their professional lives. So we're looking at senior staff wanting to enhance, refresh their skills and knowledge without taking a career break. And most, practically all of our students, they have either completed a master's degree or an MBA, and they're looking for this next academic challenge to make a difference to health and healthcare, the healthcare sector, and really take that next step in their career to sort of develop into this, what I said, what I was talking about, becoming a thought leader, not only within your own organization on a particular area, but more broadly in the sector as a whole. And we're looking to, what we're training is, sort of research practitioners. So people who can really develop ideas in a scientifically rigorous way in a professional environment, and are effective in developing that thought leadership and communicating that to a wide community within a particular field, not only within the sort of the community of researchers working in that field, but also the professionals working in that field. Yeah, so this program, what we're providing, it's a professional doctorate. So we're looking for, so this is not a program for students who are looking to move into academia. So some of our students, they already have, they aspire to take on teaching roles, education roles in universities. But this is not a program where you, for students who really aspire to, go the full academic route and go for a full academic career, doing, becoming a full-time faculty member within the university. And for those students, I think probably a PhD degree is better. So as I mentioned, this is a program with a large component of asynchronous learning, with 1 week a term for in-person learning on campus during the first 2 years. And so we help you develop a sort of an advanced professional portfolio to help you better prepare and reflect critically on the practice you're working within your organization and the broader sector. And the important research component allows for the development of scientific research skills in critical appraisal, as well as the ability to develop the rationale, methodology, and methods to develop and promote new ideas. So the start date, so we have 1 intake per year in September. It's a 5-year part-time program. As I mentioned, most of the program, it's you can do from a distance, but we have these once a term residencies during the first 2 years of the program. Applications are currently open until sometime in June 24. And the overall cost of the programs is £64,500. So I already previewed a little bit sort of what is the program structure. So we have these 3 parts. The first 2 years, it's a taught component where you will have courses. In the first year, you will have an introduction to a healthcare management research, where we introduce you to the various subfields in this area. We introduce you to sort of health system thinking, health economics thinking, to organized leadership in health, health informatics. So, and then there are many more. And we just give you a little taste of some of the important debates that are going on in those different fields. Then during term 2 and 3 of year 1, we start training you in research methods. So the module 2 focuses on research design, and the module 3 on research on data analysis, where we train you in both quantitative and qualitative data analysis techniques and methods. Year 2, we have sort of this more focused courses on sort of health system thinking, digital health, and sort of patient-centered innovation. And also, as I mentioned, we have this module, which I think makes this program really unique, which focuses on communication and communicating your research and establishing your research profile, your professional profile, as a visible profile within your field. So part 2 is this professional practice portfolio, which you will work on, which you will have to hand in year 3, which is this 5,000-word essay that encompasses reading, critical analysis, and professional reflection. And then the final part of the DBA, it's your actual doctoral thesis. So you have to write a research proposal, get ethics approval, and then sort of do the research and present your final thesis for you to get your doctoral degree. I should note that students who complete the taught component but do not want to proceed with the thesis, they can take an exit and be awarded a PG postgraduate diploma in research skills for business administration in health. So that would be after 2 years. So in terms of the admissions, so we are looking for, so for students who have a master's or MBA degree or other overseas equivalent. There are some language requirements that are the same for us as for other departments at UCL. So you should really typically already be in the healthcare sector to apply. So if your previous experience is from outside of health, you should use your application really to demonstrate a strong desire to pivot into the health sector. So the applications for the program are open until the 30th of June, 24. Most students, they have 5+ years of experience. There is interviews that are part of the process where you'll have interviews with at least 2 faculty members. And we also require a personal statement and 2 references. Yeah, this is a research degree, so very much the quality of the experience you'll have as a student. It's not only about the courses, modules you'll do, but also at the about the research, the experience working with these researchers who are leaders in their field, being part of a research environment at a top 10 ranked international research university. So here are some of the supervisors who are part of the program. So Professor Nora Colton, she is the director of the school and the founder of the school. She's an international leader on sort of health system thinking, sort of the political economy of health. She worked a lot on projects in the Middle East. She is considered to be really a leader in sort of healthcare research on healthcare leadership. Then we have Kabir Sheikh. He's the head of our health systems group. He joined UCL from the WHO. He has various honorary appointments at institutions in India, Australia, at the School of Tropical Medicine in London. And so at WHO, he was heading efforts related to the provision of universal health coverage. We have Professor Sotiris Vandoros, who is the professor of health economics. He's a leader in the area of health economics, also a visiting professor at the Harvard School of Public Health. He also uses behavioral approaches in his research. And he's done extensive research on sort of the, behavioral economics and also the regulation and competition in pharmaceutical markets. So yeah, I haven't yet introduced myself. So I'm the professor of management and healthcare innovation. I work on projects related to digital transformations in health, redesigning health systems for precision medicine. Digital transformations are an important part of that as well, are an important focus on my research. And I've worked a lot on sort of working on new technologies in health and how to implement those in health systems. Also, another area where I've done a lot of work is sort of new models for organizing R&D in the life sciences industry. I've worked a lot with biopharma companies, how they sort of manage their alliances, collaborations with universities in developing new therapies, for example. And also I've looked at sort of new models for organizing R&D in areas such as maternal health, neglected tropical diseases, liver disease, where there are so-called market failures and where you really need to bring in sort of ways to develop public-private partnerships to kickstart innovation in those areas. So we have some researchers in the area of operations research, Rodolfo Catena, and Sonia Tomini. She's also worked with Sotiris in the area of health informatics, sort of health economics. And we have Professor Julie Davis. She's has quite a lot of experience and renowned in terms of thought leadership, developing thought leadership, research in the health sector. And we have Professor Adam Lewis, who is also the program lead for the MSc in Digital Health and Entrepreneurship, who, so he has an extensive track record in starting up companies in the healthcare sector. And he's doing also quite a lot of research in digital health. So so these are some of the other upcoming events that we have planned. So we have quite a lot of programs in the sort of business programs focused on health. So you might be interested in attending some of those programs, events as well. And you can find out more about the program on our website. And but yeah, we are all here together in a group, so you can I imagine some of you have questions, so I encourage you either to raise your hand, and then I'll give the floor to you, or you can put your questions in the chat. So are there any questions? There is a first question. So we have one question. So I'm doing the MBA now. Should I take a year break, or can I start straight away? I think so I think that's really a good question. I think it really depends on where you are in your career. I think this is a very personal thing. So in general, you are more than welcome to apply and for the DBA Health program and enroll. You could enroll next year. Of course, that if you already have some clear idea of where you want to go with your career and how the DBA can help you with that. If you don't have these very clear ideas yet, then maybe it's better to go back into industry for a couple of years. But I think this is a very personal experience, as a personal decision, and I'm more than happy to sit down with you and see what's best for you. You also have a follow-up question whether you can do this program in 4 years. Yes. So of course, most of you have a very busy professional job. So it's typically quite challenging to make the time to complete your doctorate thesis within less than sort of the 5 years of the program. But certainly there are students who do a DBA within a shorter time span, who are very efficient in working and writing. And of course, also that would save you some of the fees you have to pay as well. And then another related question. So is it possible to shorten the period to 3 years and still obtain a doctorate? 3 years, in theory, yes, it's it's possible, but you're really yes, and I'm not sure how realistic that is, because full-time PhD students, who just have the PhD as their main job, often struggle to do it within 3 years. So it's really, if you can do it, it's wonderful. So the short answer is it is possible, but I would say it's challenging. Okay, then we have another question, which is not really very clear. So maybe Vero can rewrite the question. So sort of, if I have 57R, So yeah, so I'll wait for that question to be rewritten. I'll go to the next question. Will the program accept someone who has extensive junior NHS experience? But has an MBA. I think that's so. Yeah, the NHS experience plus the MBA. I think that's a perfectly is a very good profile for the program. Again, if you have more, yeah, I'm more than happy to have a personal conversation about how this program would fit in your specific professional development ambitions and aspirations. Another question about scholarship. So this is a so there's no scholarships available at the moment because this is a program, sort of very much directed at professionals. And at UCL, professional degrees, they have generally we don't have scholarships for these these more executive like programs. Should the program fees be paid full upfront or on an annual basis? And no, they don't need to be paid upfront. They are paid on an annual basis. The payment schedule, it's I think specified on the website if you want more. I don't know the payment schedule from the top of my head, but you can learn more about that from our website. And indeed, as I mentioned, one of the ways in which to reduce costs is to do, of course, this program in less than 5 years. Okay, so that's sort of the typo has been clarified. Yeah, any other questions? Let me see whether there's any students with raised hands. No? Okay, so then I think that concludes this session. So thanks again for your interest in the program. I'll be so again, as I mentioned to several in response to several questions, I'm more than happy to have a one-to-one conversation with any of you, sort of thinking about whether this is the right program and how it might or might not fit in your professional sort of aspirations, ambitions you have for your career. So yeah, thanks again. And already I'm wishing you a nice end of the week and a nice weekend. Bye.